video is going to be of me giving an injection for the hip. I treat a lot of arthritis in my office, and injections are a really nice alternative to surgery. Oftentimes they can delay or even prevent the need from getting a joint replacement. So let's go and see how we give a hip injection. Okay, so giving a hip injection is a little harder than giving a knee injection because the hip is deeper within the body. So to do a good job, we use an x-ray machine right here, and then we're going to kind of watch the needle as it goes into the joint and make sure we really hit the right spot. So the first part about giving an injection is making sure that we keep everything sterile. And so I use these gloves. And also because we're using a little bit of x-ray, I wear this gown to protect me. All right, you want to straighten out your leg here to the best of your ability. So the first step in doing this injection is to sterilize the area with a little bit of betadine. So you're going to feel a little bit of cold and wet here. And so this is the needle we're going to use here, but first we're going to numb the skin with a little bit of lidocaine. I take one shot first of the hip to make sure that we got the needle in the right spot. And then we're going to administer a little bit of lidocaine here.
Make it a double of the other stuff.
Make it a double, right? 1, 2, 3, pinch. And a little burn. And this is numbing the skin and some of the muscle so that when we actually give the shot, you don't feel much at all. Now we're ready for the needle that goes down to the hip joint. We take a couple of x-ray shots here, and this is, again, making sure that we get the spot we want. We place a very small amount of dye that you can only see on the x-ray machine that gets reabsorbed by the body very quickly to further confirm that we're right where we want it to be. So right there is perfect. You can see it sitting in the joint. And now we're finally ready to give a little bit of the medication. And this medication is a steroid plus a small amount of lidocaine so that you're not only comfortable right after the shot with the lidocaine, but then the steroid, which takes a day or two to kick in. And we're all done. So that's really it. How'd you do?
Good.
Perfect. All right, we're all good.